Not only super convenient, super. In Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
WOR, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. I just want to talk about a gentleman who came in, 63 years old. He had a Gleason 8. He was treated with CyberKnife elsewhere. He comes to us, and he now wants to deal with the problems of his body after CyberKnife. CyberKnife is a treatment that was actually developed by a friend of mine. He wanted to copy, I believe, our work and make money from selling machines. So I'm not really sure we need that machine, but there's signs and advertisements all up. Well, this man had CyberKnife treatment, and his sex life is now kaput. He urinates 4 to 5 times a night, and he came to us because he had pain and a mass on his side, and he was concerned for a Gleason 8 cancer that, in fact, that is related to his prostate cancer. So we're getting him staged up. The point of this man's experience is that he's 63 and he was sexually and urinary-wise intact. And now, after the treatment, his sex life is gone. The urine is difficult for him. And they also gave him hormones. So the hormones hide whether the treatment works or not. When you have hormones for prostate cancer, the hormones make the PSA go down pretty much to zero. So the hormones are hiding whether the treatment worked or not. But he knows that the treatment had an effect, and he believes it's an adverse effect because, as I say, his sex life is gone and his urine situation is not what it was, and he has pain and a mass on his side, which we're in the midst of working up. If you look at our data, you'll see our data, and our data is out at more than 20 years. We started our unique program in about 1990, so we're at 24 years, and Dr. Ariel Lederman is following up the data and actually had 6 presentations this year at major medical meetings about our work. So we believe in reporting our data, and you can see our prostate cancer data if you want. Just call in or come in. You can come in and pick up the booklets, DVDs, the MP3s, and we have one whole booklet devoted to prostate cancer. So you can actually see our data, and you see how it compares to proton beam and surgery and regular radiation and fancy kinds of surgery, robotic surgery. And I think when you're done reading the book, you'll be back to see us again. There's an article in last week's New York Times about a man who had spine surgery, and he got a bill for $117,000 from an assistant surgeon. Now, this patient never met that surgeon. Apparently, his first surgeon called in the second surgeon. This is at a hospital in New York City, a well-known hospital. They got bills. He got a bill from the hospital, $56,000, from anesthesia, $4,300, from the orthopedic surgeon, $133,000. And they got another bill of $117,000 from a so-called assistant surgeon. Well, the patient was livid because the bill was 20 to 40 times what the usual amount would be, and this doctor was out of network. The patient never met him. He didn't know who it was. He was called in when he was asleep, and he's demanding payment of his bill. So it's quite a story, and it's not a unique story. There's other stories also. It was in the New York Times, written by Elizabeth Rosenthal on September 20th. You can read it yourself. The beauty of our work is we take the insurances, we take Medicare, Medicaid. You know what we're dealing with. There's no secret assistants who are coming in while you're asleep. You're not asleep. Radiosurgery is non-invasive treatment. You're awake. You know us. We already get pre-approval of your insurance company, Medicare, Medicaid, so you know it's approved and you know you're covered, and you will not get a bill of $117,000 from a doctor he didn't know. That's the title of the article by Elizabeth Rosenthal, New York Times, September 20th, entitled, After Surgery Surprise $117,000 Medical Bill from Doctor He Didn't Know. Wow. Wow, oh, wow. And in the good news department, here's a woman with inflammatory breast cancer. She came to us 2 years ago. And when I was training, I'm a board-certified internist and medical oncologist and radiation oncologist. The data for inflammatory breast cancer average survival was less than a year. Well, this woman had inflammatory breast cancer. She's 2 years out. She's in complete remission, and she's actually being sent back to us for treatment of a meningioma, which is a benign tumor in the head. We actually had a caller who called a few minutes ago about, do we treat glioblastomas? We were the first in New York, and we were one of the first in America to treat with radiosurgery, which is non-invasive treatment. It's really a pinpoint treatment for glioblastomas, meningiomas, metastasis, acoustic neuromas, pituitary tumors, chordomas, and other tumors. So this woman is now going through a treatment. She's coming in every day from Staten Island. She's doing perfectly. She comes in, gets a treatment, and goes home. She's doing fine, no side effects. Our data, and we have data, our data for meningiomas, and we've presented at national and international meetings, is 97% control rate without cutting, bleeding. So you can have a brain tumor. Meningiomas are named because they come from the meninges. And there's actually 3 kinds of meningiomas, a classic or benign, and there can be an aggressive, which is a more aggressive form, and it can even be a malignant form like a cancerous meningioma, malignant meningioma. So there are 3 types, and we do treat all 3. We have a lot of experience treating them. As I say, this woman is doing fantastically well. There's an article in the medical literature that says, actually studied, that men who have had vasectomies have an increased risk of lethal prostate cancer. So there's a long-term health professional follow-up study which showed a 20% increase of advanced prostate cancer and a 19% increased risk of fatal prostate cancer in men who have had vasectomies. And one of the doctors, this is written by Charlotte Bath, and it came out just recently. One of the doctors said there's this significant increased risk. Well, you can say it's rare to have vasectomies, and it's rare to die of prostate cancer. Well, I can tell you this week I had a gentleman who came in who had a vasectomy in 1980 when he was about 30 years old, and he's very, very worried about having prostate cancer or dying. And he did the right thing. He heard about it. He came in. He got tested. He is A-OK, and we'll see him on a regular basis. But if you know someone or if you have had a vasectomy, you want to have some special attention because of this 20% increased risk of prostate cancer and prostate cancer death. Pretty worrisome. We have a woman who comes in from the south with cholangiocarcinoma. What's a cholangiocarcinoma? Well, as you know, the liver makes juices, and these juices go to the gallbladder, and then the gallbladder kind of squirts them out into the intestine to help digest food and to get rid of some waste products. Well, this young woman has metastatic stage 4 cholangiocarcinoma. She's had surgery. She's had chemo. She's had chemo. She had endless chemo. And it hasn't been working. Actually, at one point, her doctors wanted to remove her left lung because of cancer, and I tried to persuade her not to remove her left lung. I told her one day, you'll probably need both lungs. Don't lose a good lung. And I just found out about it the eve before she was going to have the surgery, and thank God she understood my point, and she canceled the surgery. But her medical oncologist, her pulmonologist, her thoracic surgeon were all pushing her to get this lung removed, and that was about 2-3 years ago. And now she has more metastasis. The chemo didn't work, and we've now treated 3 tumors in the lung and in the spine, and all 3 of those and the spine are in complete remission. We obliterated those metastases, and she's now getting treated for another tumor. So we've been quite high success rate in her for a cholangiocarcinoma stage 4. And as you heard from the callers tonight, there's quite a few callers who say, my loved one has a stage 4 cancer. Is there something to do to help? And actually, we started the program with a woman with stage 4 breast cancer in complete remission. This woman who's had obliteration of the 4 tumors that we've recently treated. So we treat a lot of patients with stage 4 cancer. Chemo's not the only option. And many people think, oh, it's only chemo. No, that's one option. And for most patients, chemo, even if it works, only works for a relatively short period of time. So that's the beauty of our work. And also our work doesn't have the systemic side effects. When chemo gets injected into the vein, it goes from head to toe. That's why people often lose their hair or have neuropathy, numbness of their hands and feet, and lowering of the blood count. Well, when we treat the cancer, we're aiming the beam at the cancer. And the beauty is the vast majority of the healthy body doesn't get that exposure to radiation. Makes sense, does it not? Hit the cancer and leave the body alone? We think so. I have another man who was in the good news department, came in with a T1C prostate cancer, Gleason 6. His PSA was 9. He was treated, and now his PSA is down to 0.93 on follow-up. He's doing great. He's fully intact. You know what that means. Intact means he's living his life. His sex life is fine. His urinary life is fine. And he's A-OK. He's A-OK. We had a woman who came in this past week, actually came in 2 weeks ago, with 40-pound weight loss and severe pain. She went to one of the emergency rooms, one of the big hospitals in New York City. She was seen there, and they sent her home. They told her there was nothing wrong with her. I saw her, the same patient, the same story, severe pain, weight loss, and I said, this is not right. She needs to be worked up. She went to the emergency room elsewhere. They didn't do anything, she reports. We worked her up. We found the cancer in the lung, actually eating through the ribs, causing that great pain, obstructing the airway, causing her shortness of breath, and actually the lung to collapse because the cancer was in the airway. It was metastatic to the hilum, and it's also spread to the adrenal gland, so there's 3 spots. There's actually new data out for lung cancers, for stage 4 lung cancer, what's called oligometastasis. That means just a few spots of cancer. Treat those spots intensely, and actually there's data showing about a 50% 5-year cancer survival rate. Can you believe that? For stage 4 cancer, treated aggressively, for oligometastasis, less than 5 or less spots, and there's about a 50% chance being alive cancer-free. With usual treatment or usual chemo, it's actually survival is about a year or less. So it's dramatically different. So stage 4 cancer, don't give up. Give us a call, 212-CHOICES, 212-CHOICES, 212-246-4237, 212-246-4237. We're at 1384 Broadway. We're a cancer treatment center. If you have cancer, if your treatment's not working, if your cancer is growing, if you're not tolerating treatment, you may want to hop out of that hospital bed and come over to 1384 Broadway and think about new choices as treatment for you. This is Dr. Lederman, cancer treatment doctor at Radiosurgery New York. We're going to hear for some voices, and we'll be back in a moment.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th.